My name is Arya Gant, and this is my oral debate. Access to psilocybin in Texas should be allowed in the treatment of anxiety and depression. Millions in America alone are dealing with anxiety and depression, and people dealing with chronic or terminal illnesses are at an increased risk for experiencing anxiety and depression. 40% of cancer patients report developing significant distress, which include panic attacks, depression, PTSD, and serious worrying. Depression and anxiety can lead to an earlier death, even in those without any illnesses. Studies show that a single guided treatment with psilocybin significantly reduced anxiety and depression and improved the mood of those with advanced cancer suffering from anxiety and/or depression. There were no safety concerns or clinically significant adverse events. Despite the success of psilocybin to address depression and anxiety, it is classified as a Schedule I drug regulated by the Federal Controlled Substance Act and is considered to have no legitimate medical use. Psilocybin is a hallucinogenic alkaloid found in some toadstools that can treat anxiety and depression. Toadstools is mushrooms, for those who didn't know, and the mushrooms are ingested orally and can be made into a tea or mixed into other foods. The mushrooms may be used as fresh or dried product. About 1 million adults are affected by a serious mental illness in Texas. It ranges from depression, post-traumatic stress disorder, to schizophrenia. Even 500,000 children that are under the age of 17 suffer from a severe emotional disturbance. Administering psilocybin professionally will reduce this number and will bring people peace and happiness, which indeed will result in better health. Clinical trials on psychedelics like psilocybin show long-term benefits in treating depression, resulting in lower costs over time. Psychedelics are proven to be effective alternatives to conventional drug treatments for mental health issues, and they may be more cost-effective as well. This combination could change mental health care as we know it. Individuals with current psychosis or who are at risk for psychotic disorders are thought to be at increased risk for prolonged psychiatric reactions resulting from classic psychedelic administration and are excluded from psilocybin studies. Psilocybin moderately increases blood pressure, so those at high risk for cardiovascular problems are excluded as well. Aside from adverse reactions that could occur if these exclusions were not made, the major risk of administering psilocybin and other classic psychedelics is that they can cause psychologically overwhelming, anxious, fearful, and confused reactions, such as bad trips, that can potentially lead to dangerous behavior in unmonitored settings. The Texas House Bill 1802 that is passed is to be entitled an act relating to a study evaluating the use of alternative therapies for treating certain mental health and other medical conditions. The Department of State Health Services, in collaboration with the Texas Medical Board, shall conduct a study to evaluate the therapeutic efficacy of alternative therapies, including MDMA, psilocybin, and ketamine in the treatment of mental health or other medical conditions, including depression, anxiety, post-traumatic stress disorder, bipolar disorder, chronic pain, and migraines. In conducting the study, the department will evaluate and determine whether alternative therapies are effective in treating the mental health or other medical conditions described and compare the efficacy of the alternative therapies with the efficacy of treatments currently used for the mental health and other medical conditions described. Positivity and peace are a part of health, and psilocybin provides that when it comes to chronic or terminally ill patients. The use of psilocybin in treatment for anxiety and depression has been proven successful and is more beneficial than not. Not only is it effective, but it will also decrease the cost of treatments in the U.S. for depression and anxiety because of the longer lasting effects compared to what is used now in the treatment of depression and anxiety. According to the data from the National Health Expenditure Accounts, treatments for mental health disorders are the costliest healthcare expense. The use of psilocybin should decrease these costs. Future research should conduct a study of the effects of psilocybin in the different species of mushrooms and toadstool. Again, my name is Arya Gant, and thank you for tuning in to my oral debate.